Stakeholders in the Nigerian Tobacco Control Alliance (NTCA) have called on the federal government to immediately prioritize tobacco control funding by increasing budgetary allocations needed for sustaining tobacco control efforts in the country. The call is coming on the heels of President Bola Ahmed Tinubu's declaration of war against drug trafficking in Nigeria and Africa as a whole earlier this Tuesday at a meeting of heads of national drug law enforcement agencies in Africa. Let's now join Clavius Gloriata for details.
Across the world, the tobacco pandemic remains one of the biggest public health threats, killing more than 8 million people a year, according to the World Health Organization. The daunting effects of tobacco use is also evident in Nigeria, as it accounts for 28,000 deaths recorded annually. Although discussions and campaigns against tobacco use in the country remain on the front burner, stakeholders say Nigeria is still a long way from hitting the target of reducing the risks and burdens associated with its use because of poor budgetary allocations needed for sustaining tobacco control efforts in the country. Although the federal government has signed the National Tobacco Control Act 2015 and the Tobacco Control Regulations 2019, most of the relevant government agencies saddled with the responsibility of sustaining tobacco control efforts remain handicapped due to limited supply of financial resources. Speaking at this press conference in Abuja, the board chairman, Nigeria Tobacco Control Alliance, Akimbode Oluwafemi, says a lack of adequate funding for tobacco control in the national budget has slowed down tobacco control efforts and frustrated efforts geared towards attaining the Sustainable Development Goals 2030 for Nigeria.
We do recognize that there are many issues needing attention in that sector. But today we are calling on government to make tobacco control one of its critical priorities. As we all know, health is on the concurrent legislative list as well as actions at all levels of government. We expect that the state government also needs to begin to make budgetary provisions and begin to institutionalize tobacco control into their healthcare programs. We will also want to ask government that we will not also say make this budgetary provision, but those budgetary provisions should be released. It's one thing to make the budget, and it's another thing that those funds are released.
Other stakeholders also shared their thoughts on why the government has to move fast to make tobacco control funding fully operational.
One of the major killers of people health-wise today is NCDs in many forms. Diabetes, hypertension, and heart disease are not the rest of them. And tobacco has been linked to all of them. So if such a product has connection and is not properly controlled, you will see that it's impeding the achievements of the SDG towards health of Nigerians.
Tobacco funding, mostly from the donors, is quietly and may soon go into extinction. Why? Because right now, even the donors, they are also looking at local capacity strengthening, how to sustain tobacco funding in country. And Nigerian government must seize this opportunity to ensure tobacco control is well funded and good amount of budget is allocated to fighting tobacco in country.
The group say they are confident that institutionalizing tobacco control funding and following through with 100% release of budgeted sums will boost the implementation of life-saving provisions of the National Tobacco Control Act 2015 and its regulations of 2019. Gloria Atta, reporting for Clearview News.